All right, welcome back to another Team Chiropractic Half Hour to Health. Today's topic is advanced home care, working on rehabbing injuries of the lower body at home safely. Before we get into everything, I want to remind you all that being healthy is more than just feeling good. We have 6 essentials to being healthy and well. They're based off the idea that all sickness and disease come from 2 things: a deficiency, something we need, or a toxicity, something we don't need. As you can see, the number 1 deficiency on that left-hand side is decreased nerve flow due to spinal subluxation. Number 1 toxicity on the right-hand side, abuse of medications and poor diet. Bring all those together, our 6 essentials that keep us healthy and well are being spiritually and mentally aligned, making sure we're reducing stress levels on a daily basis. Physical alignment, getting your weekly spinal reengineering adjustments, practicing good posture habits, and doing your prescribed home care on a daily basis. Nutritional alignment, making sure we're eating 75% of our food on the vine and avoiding those processed sugars. Exercising in alignment 6 days a week. Resting in alignment, waking up without an alarm clock, sleeping on our back with our cervical rolls and our pillows under our knees. And removing chemical stress by doing a detox twice a year. Now, remember, it takes up to 90% of a nerve to be compressed in order to feel pain. And so even though the types of pains and complaints we're going to talk about today are red flags, they are designed to tell you that something is wrong and that you need to take a step to fix it. It is not the overall being of what your health is. If we're not compressing that 10%, we may not feel pain in that area. We have to support our health through the things we know, and that is the 6 essentials. So as mentioned today, we're going to be working on lower body complaints, specifically 5 categories: lower back pain, hip pain, knee pain, ankle pain, and foot pain. As always with all of these, chiropractic adjustments can help, so make sure you're coming in to get adjusted before going through any of the therapies we're going to talk about today. Now, before we dive into the individuals, we need to start with the foundations of what it means to be injured. Now, anytime there is a new complaint, we call this an acute complaint. So usually anything within 1 to 2 weeks of an injury. Now, acute complaints can heal and then become recurrent, meaning you can have a shoulder problem that goes away and heals up fine and then comes back later because you re-injure it. You still treat it as an acute complaint if the new injury is within 1 to 2 weeks of when you start taking care of it. Anything beyond acute, we start going through what we call a subacute phase, and then finally chronic, which is anything beyond 3 months. Now, in the acute stage, it's a very simple way to handle these. It's a basic RICE principle: rest, ice, compress, and elevate. Now, there's a lot of newer research out there trying to debunk this as a common tool. However, Team Chiropractic's stance is, at the time being, there are far more positive cases showing that RICE is effective versus not. So until we tell you otherwise, please follow the RICE principle with an acute situation. Now, anything beyond acute, we call post-acute. That is where the at-home rehab that we're going to talk about today, more in-depth, is appropriate. Now, there are 3 steps to this. Number 1, stretching. Number 2, muscle release. And number 3, targeted exercise to strengthen the area that was injured. However, please do not move on from step 1 until you have talked to one of our chiropractors at Team Chiropractic and had an evaluation to help guide you through these things appropriately. It is possible to hurt yourself if you don't know exactly what you're doing. Now, once you do have your evaluation with us, use the tools we talk about today to enhance your healing process at home. Now, the reason we want to stretch after an injury is that when the injured tissue occurs, there is tightening of the muscles around there to protect you. And this is a good thing. However, this over-tightening can get out of control sometimes, and that can lead to pain that is not related to the injury itself, making your recovery less effective. So, a gentle stretch to the area can help alleviate some of that pain and relax those muscles to promote the healing process more efficiently. In cases where the tightening becomes overbearing, that is when we get to the muscle release technique. Over-tight muscles will lead to adhesions, also more commonly known as knots in the muscles. These knots can be very, very painful. It can lead to chronic pain syndromes. Again, they're not really related to the initial tissue damage. And if we allow these to stay there, not only is it going to be more uncomfortable, but it's going to slow the recovery process. We break these down by applying steady pressure to the area for around 10 to 20 seconds in order to knead the dough, if you will. So imagine you're a baker, you've got your dough out on the countertop and there's a bunch of bubbles in there. You're trying to knead that out and flatten that dough. That's exactly what we're doing with our muscles with muscle release. Now, when you do this, there is a certain amount of pain that is going to be expected. This is why we want to make sure that before you go through this on your own, you talk to us first so we can help guide you to where these points are. What we don't want to do is apply this pressure over injured tissue. We want to make sure we're only hitting on the adhesion points. Now, this can be done in a variety of different ways. You can do it with a foam roller, which is what you see in the upper right corner of your screen, a muscle ball or a lacrosse ball in the bottom left, a muscle stick in the bottom center, and my favorite, the Theracane on the bottom right. Depending on what muscle group and what type of adhesions you have and what equipment you have available will determine what tool you use. You could also just get a partner to help press on these things for you. Ultimately, if the at-home muscle release is not effective, we may need to do a professional intervention in our office doing either myofascial release, active release technique with Dr. Hemmer, or laser in order to help break these down for you. Now, finally, after you've released and stretched the muscles, we want to begin exercising to strengthen. So we always start with what we call isometric exercises. These are exercises that contract the muscles and work them without actually moving the joint. Think of flexing in like bodybuilder standpoints. They're tightening those muscles up, but the joints aren't moving. We always start here because it's generally the safest way to start and not risk re-injury. And all of these exercises should be held for roughly 7 to 10 seconds each rep. From there, we'll move on to isotonic exercises, which are your more traditional exercises. This is where joint movement occurs. For the purposes of rehab, we always want to have light resistance and higher repetitions. That's a greater number of repetitions per exercise. And we always want to perform these exercises slowly. Again, this is for safety purposes. If you are moving very rapidly, you're more likely to injure the tissue versus help it. All right, so for our first complaint, lower back pain, remember the most common cause of lower back pain is spinal subluxation. So make sure you're making your appointments regularly, coming in as often as you need to get adjusted for this. In addition to the home care we've already prescribed you, here are a few things you can do for yourself. Muscles we want to stretch focus on the hamstrings, which are the back of the thigh, the IT band, the side of the thigh, the lumbar muscles, which are your lower back muscles, and your gluteal muscles. Those are the muscles in your buttocks. Now, in order to stretch the hamstrings, there are a variety of choices you have available to you. You can see in the pictures you can do this standing, laying on your back, or seated. The common theme with all of these is you are trying to bring your head closer to your toe or vice versa, with the knee straight. That's very important. If you don't keep the knee straight, the hamstring is not going to be stretched properly. So try out a couple different ways and see which ones you like better. No one works better, it just comes down to personal preference. Now when stretching the glute muscles, it is easiest to do this on your back, pulling your knees towards your chest, either directly, as in the picture on the bottom right, or at an angle, turning out to hit some of these side glute muscles, the picture in the top right. Doing both consistently can help alleviate lower back pain by stretching those muscles in the glute area. Now, the IT band can also be done in either a standing or laying position. In the picture in the top left, you're seeing a stretch of the right IT band by supporting your weight on your left side against a chair, or you can also do this against a countertop, and pushing the hip away to the right side. The bottom left, the gentleman is using a strap to pull his leg up and over across to stretch the outer portion of that right IT band. For the lumbar stretches, there are two that we want to focus on. The top right is an example of a prayer pose, where in a kneeled position, driving your buttocks into your heels, you are then stretching out with your hands in front of you as far as you can. The bottom right is a rotation exercise where with your shoulder blades flat against the floor, you're simply turning your hips to either side, holding that stretch for a good 10 to 15 seconds. So for lower back pain, the muscle we want to release is the piriformis muscle. This is the little muscle that runs along the side of your tailbone on either side. If your lower back pain favors one side or the other, release the piriformis on that side. If lower back pain is across both sides, then you want to release both piriformis muscles. This is easiest done using a muscle ball. And in the picture here, you'll notice the woman has a small orange ball pressed against the side of her tailbone. To actually apply pressure to this, she is going to turn her body so that her body is pinning the ball against the floor. The floor and her body squeezing the ball into that muscle is where the pressure is actually applied. Remember, this is very painful if you apply too much pressure, so be careful to support your body weight so you're not putting all of it on at once. When doing this, do for about 2 to 3 minutes, and please make sure you breathe during this process. Then finally, muscles we want to work on strengthening particularly are your core muscles, both the abdominals and the core in the lower back. The easiest and safest way to progress through this is a daily plank exercise. An example of this is in the bottom right of your screen right now, holding basically a modified push-up position either on your elbows or with your hands fully extended like a push-up as long as you can. The Superman exercises that you should be doing anyway with your home care should also be performed daily for 15 to 30 seconds, 2 times a day. Moving on to hip pain, again, remember, make sure you're getting adjusted and evaluated consistently with hip pain. But as far as exercises and muscles to stretch at home, we always want to start with your gluteal muscles and your IT band, just like with lower back pain. But then we also want to add in a stretch for the psoas muscle. The psoas is your deep hip flexor running across the front of the thigh into the hip. An easy way to stretch this at home is with a modified lunge position. This picture shows an example of a right psoas stretch because the right leg is on the ground, knee on the pillow, lunging forward and driving that right hip forward. Her upper body should always stay erect and perpendicular to the floor when doing this exercise. If the upper body leans forward with the front knee, you're not going to get a proper stretch. So make sure you're staying upright and always breathe when you are stretching. Now, with the hip, muscles we want to release are, again, the piriformis muscle, just like with lower back pain. But we also want to release the IT band. Remember, that's the outer portion of the thigh, and the quadriceps muscles, the main big muscle in the front of your thigh. Both of these are very easily released using a foam roller, pinning the muscle against the ground. So on the left is an example of a quadricep release, using body weight over the foam roller to release the muscles in the quadricep. And the IT band is demonstrated on the right side of your screen. The muscles we want to strengthen are the hip stabilizers. There are a variety of ways to do this. All 3 listed here are appropriate and should be tried based on your own tolerance. The wall sit is demonstrated in the bottom right of your screen. And for safety purposes, this should always be done either with pillows underneath you in case you were to fall, or with some sort of support next to you so you can use your arms to grab on if your legs fail. With the wall sit, this is a static holding of a squat position up against the wall using your legs to support you. It can be very challenging, and so you always want to make sure you have that safety net with you. From there, walking lunges, either in a straight manner or a side manner, can be very helpful. Just going through a gentle lunge as deep as you can until you feel a muscle fatigue in the legs. And then simple air squats can be done to help strengthen those hip stabilizers. All of those are appropriate. There is no ramp up compared to some of our other body parts where you have isometric versus isotonic. All 3 of these are appropriate for hip pain. For knee pain, muscles we want to focus on stretching are the quadriceps, remember the front of the thigh, the hamstrings, which are the back, and then your calf muscles, which are the big muscles behind your shin. The quadriceps can be stretched in either a standing position, as you see in the top left, or if balance is an issue for you, in a seated position on the bottom left. In both pictures here, we're seeing a stretch of the left quadricep. The basic concept is you are bending your knee and pulling your heel towards your backside. The calf can also be stretched in either a sitting or standing position. If you're going to stretch it in a seated position, you have to be on the floor with your leg extended. You can use either some sort of exercise band, a long towel, a belt, a dog leash, anything that you can use to wrap around your foot and pull your toe back towards your shin. If you're doing this in a standing position, like the bottom right of your screen, you need to support yourself against a wall, do a modified lunge forward with the unaffected leg, so in this picture that'd be the left leg, and lean forward, bringing again the toe towards the shin. Remember, the bottom right example is an example of a right calf stretch because the right leg is back with the knee straight. As always with the calf, the idea is bring your shin towards your toe or vice versa. Muscles we want to release with knee pain include those same calf muscles and the IT band. IT band can be released just like we've talked about earlier. The calf muscle is released in a very similar manner. You can use either a muscle ball or a foam roller, and again, pin that ball or roller with your leg against the ground. If you're not able to get enough pressure with just your leg, you can wrap your other leg over the top or across to apply extra weight to bring pressure onto that calf muscle. And then finally, muscles we want to focus on strengthening the knee pain are particularly the quadriceps and the VMO. That is the middle portion of your quadricep. Now, this always wants to begin with isometric knee extension before progressing to more advanced moves like the knee extension with the band, foot externally rotated. So a couple examples here. The isometric knee extension should be done in a seated position on the floor with your leg extended. You want to take a towel, wrap it up so it's nice and thick, and place it under your knee. You then want to proceed to drive that knee directly into the towel, trying to flatten it against the ground. That is isometric knee extension, should be held for 10 to 15 seconds at a time, making sure you are breathing. As far as the number of repetitions, should always be done until you feel a muscle burn in the area. From there, we can progress to the banded extension, which is on the right side of your screen. This is best done in a seated position in a chair. See in the example here, the band is tied off to the chair behind him, wrapped around the affected leg, and you're going from a bent position to a straightened position. It is very, very important that when we do this, we turn the foot outward. So in this example, this is a right leg that we're trying to extend. The right foot should be turned to the right. If it is the left foot, it should be turned to the left, always turning away from you when doing the band extension. Finally, the last exercise you can progress to is an air squat, or if you have the exercise equipment available to you, a Bosu ball air squat, which is demonstrated in this bottom right of your screen. The Bosu ball adds an extra layer of instability and challenge to the exercise, although if you don't have access to that, a simple air squat is fine. As with all of our air squats, we are always trying to go as deep as you can up to a 90-degree knee bend. We never want to go any farther than that for risk of causing more knee pain. And always do your air squats nice and slow and in control. Next, for ankle pain, muscles you want to focus on stretching are those calf muscles, just like we talked about previously. But we also want to add in something called a foot circle. This is done by taking your affected ankle, rolling it in a clockwise and counterclockwise position to maximum range of motion, so really exaggerate how much movement you're able to get. Take it nice and slow, and usually this is done for 10 to 20 repetitions to each side, about once or twice a day. There's not much need to do more than that, although it is an exercise that you can really do as much as you want to do without risk of injury. Muscles we want to release are the Achilles tendon, which is the back of the heel between the calf muscle and the actual heel bone, and your plantar fascia, the bottom of your foot. Now, in order to release the Achilles, we do something very similar to how we release the calf muscles. We pin our lower leg between a muscle ball or a foam roller, but instead of keeping it focused on the big meat of the calf, we bring it down closer to the ankle where that tendon becomes very thin and hard. We focus pressure over that area. The plantar release is easiest done with a muscle ball, or a frozen water bottle also works really, really well. Sitting or standing, it does not matter, but the goal is to apply steady pressure over that arch of the foot on that ball or water bottle. Remember, these releases are going to be painful if done correctly, so be careful with how much pressure you're using and go based on your own personal pain tolerance. And the muscles we want to strengthen are your ankle stabilizers. There are 4 stabilizers that follow 4 different movements. You'll see in the first 2 bullet points: plantar flexion, dorsiflexion, medial and lateral flexion. Plantar flexion, quite simply, is your toes going away from your shin. Dorsiflexion is toes going towards your shin. Medial flexion is the foot turning in. Lateral flexion is the foot turning out. So in our pictures here, the top right corner is an example of medial flexion with the left foot. So the left foot is turning inward. The right foot is being used to help stabilize the band in place, giving it a place for resistance. In order to do lateral flexion, we would just do the inverse of that, where instead of crossing the right leg over the left, the right leg just simply stabilizes from the other side. The bottom right of your screen shows an example of dorsiflexion. In this example, the left foot is standing on the band to apply resistance, and the right foot is pulling the toes towards the shin. In order to do plantar flexion, you would simply remove the left foot from the equation and use your hands as resistance as you pull the toes down away from the shin. As with any banded exercise, we want to take it slow and go until you feel muscle fatigue. The final stage of strengthening the ankle stabilizers is single leg stands, simply balancing on one leg at a time as long as you can. Be careful not to fall. Have something around you to support yourself with if you need to catch yourself. And if you want to challenge yourself even further, that's where a Bosu ball, if you have one available to you, can come in handy. Or instead of standing on a flat surface, we stand on that ball, adding the extra layer of instability. Then finally, for foot pain, muscles we want to stretch are the calf muscles, just like we did prior, and the plantar fascia. The plantar fascia stretch is very similar to a calf stretch. However, the only difference is that instead of keeping the affected foot back, we're going to pin the toes up against the wall with your heel on the ground. As you do this, you lean forward towards the wall, and you will feel a stretch going through that arch of the lower foot. The muscles we want to release, again, the plantar fascia, just like we talked about with ankle pain, rolling steadily with pressure over at muscle ball or frozen water bottle. And the muscles we want to strengthen are the toe flexors. There are two staples for toe flexor strengthening, and they are called the towel grab and the marble grab. The towel grab is performed in a standing position. You're going to take either a washcloth or a hand cloth, roll it out entirely on the floor. You're going to step on one end with the foot that hurts, allowing just enough space for the toes to be touching the towel. The rest of the foot should be on the floor. And then you'll proceed to use your toes to grab that towel, bunching it up underneath, trying to get the whole towel towards you using just your toes. This will help strengthen those toe flexors as well as the plantar fascia. Similarly, the marble grab is an exercise where you pick up a small object, in this case a marble, with just your toes and try to place it into some sort of cup or receptacle. The entire goal is to work on the dexterity and strength of those flexors. I want to thank you all for watching and look forward to seeing you in the office soon.